Good day, students. You are welcome to Nursing 245, Nursing Practical 2. This is a practical course that is designed to enable students gain competencies in medical, surgical, obstetric, and pediatric nursing. The focus will include assessment of patients, admission, discharging of patients, administration of medication, and care of the patient using the nursing process. There will be practical examination at the end of the session. Students are expected to continue with practical experience during the intersemester break. In this session 1, we are going to look at managing a patient with infectious illness. An infectious illness is an illness caused by pathogenic organisms such as bacteria, viruses, parasites, or fungi, and the disease can be spread directly or indirectly from one person to another. For example, cholera, shigellosis, and then other conditions. It is essential to practice frequent hand washing, wear protective clothing such as gowns, masks, and gloves when caring for such patients as appropriate to prevent cross-infection. The key topics to be covered in the session are as follows: hand washing, using gloves and masks, wearing sterile gloves, barrier nursing, notification, primary, secondary, and tertiary care. For the hand washing and using gloves and masks, we will demonstrate how to don those items. For your reading, we have Latte Edna 2014, Tips on Practical Nursing Procedures by Mass Associates, and then Standard Procedure Manual for Nurses in Ghana, Volume 1. Hand washing. Hand washing is a vigorous breath rubbing together of all surfaces of hands lathered in soap, followed by rinsing under a stream of water. What are the indications? Before contact with patients who are susceptible to infection, for example, newborn infants or immune-suppressed patients. After caring for an infected patient, and then after touching organic materials, and then before performing invasive procedures such as administration of injection, catheterization, and suctioning, and then before and after handling wound dressing or touching open wounds, after handling contaminated equipment, and then finally between contact with two different patients in high-risk units. What is the purpose for hand washing? 1. To remove dirt and transient organisms from the hands and to reduce total microbial counts. 2. To prevent nursing personnel from pathogenic organisms. 3. This is a simple technique method of infection prevention. 4. It is a single most important procedure for preventing nosocomial infection. 5. The hands are important route of transmission of infection. And finally, hands must be cleaned before and after every patient contact. What are the requirements for hand washing? You need a working tap, a Veronica bucket with clean water in it, liquid soap or cake soap, clean towel or electric hand dryer, clean water in a cup or a jug, a bowl to wash in, and then nurse's notes, and then a pen. Now, for the component for hand washing, before you start, you first have to remove your jewelry and avoid any nail polish. Stand slightly away from the sink to avoid being splashed with the water. Wet hands under running water. Apply soap to all surfaces of the hands and wrist. Lather the hands using plain soap or liquid soap. Wet hands palm to palm. Rub hands over back of left and vice versa. Rub palm to palm, finger interlaced, back of left fingers to right palm, fingers interlocked and vice versa. Rational rubbing of right thumb claps in the left hand and vice versa. Rub left palm with clasped fingers of right hand and vice versa. Left wrist with right hand, vice versa. Rub vigorously for at least 10 seconds, paying particular attention to the areas between the fingers and under the fingernails. If the hands are visible sore, more time may be required. Rinse the hand under running water, allowing to run downwards from the wrist to the fingertips. Dry hand thoroughly with a clean, dry towel under a hand dryer. Clasp the hands in front, ready for procedure. Our next topic is wearing of masks and gowns. For the definition, this is a procedure that involves wearing a mask and especially stitched gown in the operation theater to maintain asepsis and to protect the nurse from contaminating herself or others around her. What is the purpose for wearing a mask or a sterile gown? To prevent dispersal of droplets from wearer to environment and patient, to prevent contamination of sterile field, and then to enhance easy handling of sterile equipment. What are the requirements for applying masks? You need articles for hand washing, a sterile chittle faucet in a container for disinfectant solution, a sterile drum containing a sterile gown, and then a disposable mask. For the procedure, after performing medicated hand washing, take the sterile mask. Hold it by the two strings, keeping top edge above bridge of the nose. The top string at back of nose. The other two lower string snugly around the neck, well under the chin. Gently pinch upper portion of mask around bridge of nose. Gowning. Grasp the sterile gown at the crease near the neck. Hold it away from yourself and permit it to fold freely without touching the uniform. Hold the gown at the shoulder level from inside and put each hand directly into the armhole. Extend the arm and hold hand upward at shoulder level while putting through the armhole. The circulating nurse pulls back the gown from the inside so that the upper limbs go into the sleeves. The circulating nurse pulls back the gown from the inside so that the upper limbs go into the sleeves. The circulating nurse ties the gown at the back. The waist ties are loosened by the scrub nurse and the flap is brought around the waist by the use of chittle faucets held by the circulating nurse, and it is tied. Removal of gown and masks. Untie strings at the back of the gown. Remove gown. Fold inside out to cover outside of the gown. Dispose gown into designated receptacle. Masks. Wash hands. Untie lower strings first, then the top strings, and pull masks away from the nose. Hold masks by the strings and discard into appropriate receptacle. We are now on topic 3, wearing a sterile glove. Gloving is defined as the donning of pair of sterile gloves to protect one's own hands from pathogenic microorganisms and to avoid contamination of a sterile area by hand. The purpose is to protect the nurse from pathogenic microorganisms and then also to handle sterile articles without contaminating. The requirements are: you need a soap, antiseptic detergent, running warm water, a nail brush in antiseptic lotion, a towel, a sterile one, mask, and then a cap, and a pair of sterile towel. For the procedure, perform thorough surgical hand wash and dry hands using a sterile towel. The circulating nurse removes the outer glove package by carefully separating and peeling apart the slides. Scrub nurse pulls out the inner glove pack, taking care not to touch the outer one. Grabs inner package and lay it on clean, flat surface just above waist level. Open package, keeping gloves on wrappers inside surface. If gloves are not pre-powdered, take packets of powder and apply lightly to hands over sink or waste basket. Identify right and left glove. Each glove has a cuff of approximately 5 centimeters or 2 inches wide. Glove dominant hand first, with thumb, the first 2 fingers of the non-dominant hand, grabs edge of cuff of glove of dominant hand. Touch only the surface of the glove. Carefully pull glove over dominant hand, making sure the thumb and fingers fit into the proper spaces of the glove. Slip the fingers of the glove dominant hand under the cuff of the other glove. Keep thumb of glove dominant hand abducted back to avoid touching of exposed non-gloved hand. Carefully slip the glove onto your non-dominant hand, making sure that the fingers slip into the proper spaces. With gloved hands, interlock fingers to fit the gloves onto each fingers. Removal of gloves. Remove the first glove by grasping it on its palmar surface, taking care to avoid touching wrists. Pull the first glove completely off by inverting or rolling the glove inside out. Discard the receptacle. Take fingers of bare hand and tuck inside remaining glove cuff. Peel glove off inside out. Discard in receptacle. Wash hands. For our topic 4, barrier and reverse nursing. What is barrier nursing? Barrier nursing is adopted when the patient has a disease which can be passed on to others. For example, cholera, pulmonary tuberculosis, measles, and etc. It is particularly effective in those infections in which the main route of transmission is by the orophycal route and airborne. Isolation ward or corner, protective gown, boots, face masks, gloves, etc. are needed. Patients of this nature ought to have disposable items or equipment that is used for him alone, which are carefully discarded or disinfected after use. It involves concurrent disinfection. This is the art of destroying microorganisms during the care of a patient with a communicable disease or an ongoing disinfection of patient, environment, and articles. Terminal disinfection. This is disinfection of the environment and articles of a patient after discharge. And reverse barrier nursing is adopted when it is necessary to protect the patient from the possibility of infection from outside source while he is a susceptible condition. For example, when a patient has a transplant surgery, leukemia, burns, or acute renal failure. For our final topic, notification. Notification is done during epidemics or occurrence of notifiable diseases such as cholera. Public health and disease control units are informed. Any communicable disease outbreak, the following sequence of events must be followed. 1. Identification of the cause. 2. Notification. Notify the local health authority of findings of the investigation. 3. Treatment of cases. 4. Interruption of transmission. 5. Prevention of reoccurrence. And 6. Analysis and report writing. And 7. Surveillance. And for the mnemonic INTIPAS, that is notification, identification of cause, notification, treatment of cases, interruption of transmission, prevention of recurrence, analysis and report writing, and then finally surveillance. Health professionals are required to notify the health authorities through the use of appropriate forms when a test indicates a person have or has any notifiable conditions. The information collected is used to detect outbreaks and prevent further cases, monitor disease, epidemiology, and implement interventions like immunizations to protect public health. Timely notification enables health departments to identify sources of exposure and implement strategies to prevent further cases where appropriate. Now, we are going to look at Betty Newman's level of prevention and how to apply Betty Newman's model in our prevention of diseases. Betty Newman has 3 levels of prevention. So the levels of prevention as developed by Betty Newman are useful in preventing, managing, and preventing disabilities in patients. Primary prevention. This involves all efforts that are directed at preventing people from getting infected with diseases. For example, practicing hand washing, condom use, and use of intermittent treated nets. To prevent malaria, etc., are termed primary prevention because they prevent the individual from getting infected with the disease. Secondary prevention. This involves prompt reporting to the hospital, early diagnosis, early treatment of cases. These measures ensures the client is treated and discharged safely without any complication. And the third prevention, that is tertiary prevention. This involves measures such as prevention of disabilities, training, physiotherapy, etc. to make the individual functional by preventing other complications. So in summary, we have looked at infection prevention, donning of gloves, donning of gowns, removal of gowns, removal of gloves, and then hand washing. And also we have looked at how to notify when there's an outbreak of diseases, and then how to apply Betty Newman's model to our levels of prevention. That is the 3 levels that we mentioned, that is primary, secondary, and tertiary prevention. So for your reading, you have Latte EM 2014, Tips on Practical Nursing Procedures, and then Standard Procedure Manual for Nurses in Ghana.